I know some of you joining are a little familiar with Daybreak, and I think we are, brand new to others. So what we'll do today is go over some of our services, just to kind of introduce who Daybreak Health is and how we partner with school districts. And then we'll introduce our new option for the no-cost partnership model. And so the intention is that at the end of 30 minutes today, you'll come away with a good understanding of how that partnership works, who can be referred, what they're being referred to for services, and how you can get started if you are looking to add more mental health resources for your students and families with limited budget. So I'll go ahead and dive in a bit. So, to introduce Daybreak Health and who we are, for those of you who are not familiar, we are a school-based mental health service provider, and we are currently available to over 1.5 million students across the country, which we could not do without our school partnerships. So we partner with districts on our joint mission to reduce barriers to care, mental health care for young people. And so we really focus on these 4 areas to build a valuable, lasting partnership with these districts, to that end. So focused on rapid access to care. So our mental health services do not have wait lists, that we really want to get students started. We focus a lot on clinical improvements and being able to track progress and have those metrics on clinical impact for your district so that you can, prove the case for more support and be sure that what you're using and what you're offering to your community is effective. We always provide materials to our district partners to help them drive usage, drive engagement among their students and their families, and really want to take the burden on our end of the partnership to provide everything that you need to do so. And then, of course, what we'll be focusing on today is the financial sustainability piece. The need for mental health services among youth, unfortunately, continues to climb, and that is not the case for school district budgets. So I know a lot of districts lately have been looking for more services, looking to fill gaps for certain populations for mental health services, but are doing so with limited budget. And, same as they're looking towards the future, not a lot of certainty that they'll have the budget that they need to work with for the level of programs that they need to bring in for their youth. So we will, of course, talk about the model, the no-cost partnership model, but I wanted to start off with the basic context of what that partnership does provide. So as a virtual mental health service provider, Daybreak offers a 12-week CBT-based teletherapy program, and we can accept referrals across K through 12. So what that looks like, for students who are ages 10 to 19, we offer a one-on-one teletherapy program, and that's, one-on-one clinician with the student. We're taking clinical impact metrics as we go. And then when we're working with younger students, so ages 5 to 11, we are actually bringing in the full family, so the parents or caregivers in those sessions with the kiddo. The focus is still on the child's development, so behavioral and emotional improvements for the child. But as you know, or as you can imagine, really important to work on at-home routines, family dynamics, and how we can kind of work together to build a healthier environment to see those improvements in younger students. So there's a lot we could talk about with the family program. That might be another 30-minute session, but those are kind of the 2 options for referrals when working with Daybreak to refer for teletherapy. So all virtual. And because of that, sessions can be held on campus or off campus. For districts who prefer to provide those services on campus, we can totally talk about the ways that a lot of our partners have set up that private space for those sessions on site. But these can be done at home too. So students can log in before school, after school, on weekends, whatever works for them to do their sessions. Our clinicians are available Monday through Saturday, 8 a.m. to 8 p.m. And that's the same over summer and holidays too. So that does a lot for the consistency of care, which can be really helpful. I mentioned this is a 12-week program. We do have the option to provide a few more sessions in the cases that that's needed, but we've been collecting a lot of clinical data on this program and have seen that students that complete 12 weeks are seeing more than 80% improvement on the GAD-7 and PHQ-9. We've also seen those students typically go down one full band in severity after being discharged from the 12-week program. So um, I know there are some referral partners out there that a lot of districts work with where you can refer a student for services, but you might not know what happens next. Did that student get into care? Are they still on a wait list? How did it go? Is it going well? Did something else happen? Our program is going to be a lot different. So we will stay close. We'll provide a dashboard where school staff can monitor progress. So not only can they make their referrals from the dashboard and check in to see, if and when that student got matched and had their first session with their therapist, but they can see, are they continuing to go to sessions and are they seeing improvements? And so we'll always be able to report back on this kind of impact data that you're seeing here for your specific program. We are very intentional about our matching process. So we match students with clinicians intentionally based on their preferences and needs in spoken language, any preferences they might have in identity, gender, personality type of their clinician. And we have a lot of Spanish-speaking clinicians and over 10 different spoken languages represented among our clinical team. And that is really helpful when it comes to the parents and families, not just for family teletherapy, but also for communicating about therapy when, it's a one-on-one case and parents just want to know, what is this that my child has been referred to? What's going to happen? Tell me more about therapy. It can be really helpful there. But all of our clinicians have experience working with youth. They have experience working with youth virtually in the school system and keeping young people engaged in that way. So that's a really high-level overview of the mental health services that we can accept referrals for. And I'll talk a little bit more about the impacts that we are seeing of students who complete those programs. So zooming out a little bit more to the no-cost partnership and how that works. So I talked about the dashboard where school staff can make referrals. So whoever your designated staff would be, counselors or social workers can make referrals, and so can parents. I'll talk a little bit more about the family engagement pieces in a moment, but we can accept those referrals from parents or school staff. And the way that we're able to offer this option for a no-cost partnership is through our partnerships with insurance providers. So Daybreak will handle billing to insurance whenever eligible. So we do accept referrals for Medicaid, private, and uninsured students. So there's no barrier to entry there. We will bill to insurance wherever eligible, and the families do pay their copay, coinsurance, or their deductible as dictated by their insurance plan. Daybreak will also handle the parental consent and kind of all of those administrative pieces that go along with getting care started. So this is kind of the main aspect of the no-cost partnership model. So we're able to start up a partnership with the district with an MOU to take these referrals, work with our insurance partners to take care on that end to get students up and running with their sessions. Another piece of this partnership are the family and staff mental health classes and the engagement pieces that I mentioned that we support districts with to get those going. One thing I'll mention here, a common question we got is, okay, so it's a no-cost partnership. Does that mean that you need us to refer a certain amount of students? The answer is no. We don't have a minimum or a requirement when it comes to referrals made. Of course, we want you to use the service. It's a quality service. It's, the point is that we're here to help these students and families. So we don't want this to be something that you check off and just collects dust, but we will always work with you to talk through how to drive that use and engagement. I will also say, um, I don't see any questions coming up right now, but I will do my best to save some time for questions at the end. So feel free to use the chat if anything comes up. Alrighty. So the other piece of this partnership, in addition to the teletherapy programs, is the Family Toolkit. So we offer monthly mental health classes for free, free to the district and free to families and staff, that essentially any interested families within your district community are welcome to log into. And this is an additional educational piece. The classes are held online once a month, English and Spanish, and there'll be topical mental health issues. So, for example, here, October is Suicide Awareness Month. So, during October is when we'll hold our class on youth suicide prevention. This month is exercise and teen mental health, I believe. And then, Tobacco Awareness Month, we'll talk about vaping and teen mental health. These will cover a lot of different topics that specifically relate to youth mental health issues, social media, bullying, those kinds of things. Recordings remain available too. And this can be a great way not only to kind of work with families to get on the same team around understanding youth mental health better, but also knowing what are the next steps, what are the signs to look for, what can you do if you notice the signs, but also how can we create healthier environments for our youth? So what can we do to be preventative, and what can we do as the adults in the room to be supportive to youth who might be going through youth mental health issues that sometimes are kind of hard to notice without a little bit more education. So these educational pieces, one thing that personally I really love about them is that it helps us, as the grown-ups, to be able to identify those silent sufferers and to be proactive about helping those youth. So I mentioned the recordings are available. We have more resources that are available too. So articles and guides, again, all to that same end of helping families to be more educated and supportive around youth mental health. Staff can access these as well. So we do have some districts that use these classes for PD, and same with the recordings. We also provide access to the teletherapy referral form for parents. So if, they do come to see that their kiddo may have some signs of mental health concerns, they're empowered to make that referral as well. And so that's just an example of what the form looks like there. I see a question from Sheila. Thank you. Talk about affordable self-pay for families who don't have insurance. Yeah, I'm happy to get to that now. So for families who don't have insurance, Daybreak develops one flat rate for self-pay. So this is a new program, and that is being finalized as we speak. So should you, be curious to work with Daybreak, we will confirm that for your district. But that is a major piece of it, right? Is we want this to be equitable for uninsured students. So we're able to leverage those, health insurance partnerships to work out, the most affordable rate that we can as just a flat rate for all of those students from uninsured families. Thank you for asking. That is a crucial piece. So when we're looking at a little bit deeper into who is this service for, who can we refer, what kinds of students are appropriate for the program, our CBT-based program is appropriate for students with mild to moderate and including some moderate to heavy presenting mental health needs. Any student in active crisis is not going to be a good fit for a virtual service. Similarly, any presenting issue that requires physical monitoring to track progress would not be appropriate for a virtual service. So something like an eating disorder or substance use is the primary concern. But these are some examples of, issue areas that we can treat. So we get a lot of referrals for students with anxiety, stress, relationship issues, depression, executive functioning, trauma. These are all common referrals and common issues that we can treat, that our therapists can work with students on. And again, we're available to talk through these. If there's ever, a question, a referral comes up and it's just not 100% clear to the counselor or social worker if this would be the right program, we can talk about it. Again, this is going to be a more involved partnership, and we're available to you. It's not going to be just kind of sign up and see what happens. We'll definitely be able to speak to any questions that come up, and share with you how your students are doing. So I wanted to talk a little bit more about the impact metrics that we have been able to see with our districts that we've been working with for a few years, because they're pretty compelling. And I know that a lot of districts are in the position of, needing to tie their resources to their district-wide goals that they might have around academic improvement, improving attendance. And so just wanted to share this with you. So as you look at these statistics, we're looking at a study of all of the students with presenting mental health needs, and then comparing those who completed Daybreak's 12-week clinical program and those who did not do the program. So we've seen a 3% difference in higher, attendance in those students with mental health concerns that completed the program versus those that didn't do the program. Same, quite an impact on disciplinary infractions and suspensions post-program versus those that did not. So these are the kind of metrics that we can measure in a partnership over time. Should a district be working with Daybreak and wanting to track how does this resource serve students, not just in terms of, did these mental health symptoms go down, but are we seeing an impact overall on how that improved mental health affects academics, attendance, behavior infractions, and so on. So to kind of summarize the benefits of the no-cost solution, just to kind of summarize, so the no-cost model does make these mental health services readily accessible to all students. So Medicaid, private insurance, uninsured students, we can accept all of those referrals. And we can provide an earlier intervention and be able to serve some students who are on kind of the tier 2 and tier 3 levels of needing some support. Because we don't have wait lists and we can get students into support within a few weeks, we are able to get started with an earlier intervention for them and reduce, those not just mental health symptoms, but those kind of behavioral issues pretty strongly once we get in there with an earlier intervention. And there are some more benefits to that. So having these educational pieces does a lot for, reducing stigma, creating a more positive school climate, and really just increasing the level of accessibility. So this can be used as a partnership that some districts may want to leverage for, specific populations. So you may have a gap in services for Medicaid populations or for private insurance, I'll hear sometimes. And so this program can be leveraged for that, as well as, a more widely used program. So at this point, I'm happy to take any other questions. I see, hello, Sheila. I opened the Q&A and have a hello in there. But yeah, happy to keep this one pretty brief. So if anyone has questions, please feel free to let me know. I wanted to talk a little bit about getting started with Daybreak Health. So with this unique partnership where we're able to get started, no cost, there's no minimum of students you need to refer. It is a pretty simple process to get started. And so we essentially can send an MOU to the district. We'll want to go over that with you. And as I talked about, we'll do a lot to share engagement materials and kind of talk through how to use those because we want to be a collaborative partner with you. But you will see a poll come up at the end of this presentation, just to, one question poll to gauge your level of interest in starting up one of those partnerships. And so we will respond to you accordingly there. And thank you for your question, Michelle. I will actually share the recording of this presentation too. If you'd like the slides, I can share those as well, but the recording will go out after the session, so you're able to review all of this. Any other questions? I hope that I can get, are you currently in northeastern North Carolina? Well, we have just started working in North Carolina, so we just started a partnership with Wake County, Guilford. I think we have a couple of others, but we are really getting started with North Carolina and would love to work with more districts in northeastern. Thanks for asking. And if you're curious to be connected with folks to hear about their experience working with Daybreak, just let us know and I'll see if there is someone who would like to talk to you about how their experience is going working with Daybreak Health. Okay. Do we have any other questions from folks in the audience about how, insurance, teletherapy, clinical model, engagement pieces? One question that often comes up is about parental consent. I think I did mention though that yes, that is something Daybreak does handle. Great. Um, Dr. Battle sent in a question, are sessions done during the school day only? No, not only during the school day. They can be done during the school day if you prefer to have your services offered on site, but students can access from home, and so they can do that before, after school, as well as on Saturdays over the summer. So no, one of the benefits of teletherapy is that increased accessibility. And again, if this is, kind of a policy of your district to have services that you provide hosted on site, we can talk with you more about how districts have set that up. Yeah. Part of a threat assessment or suicide assessment, we don't provide those assessments. But we can totally talk to you about kind of your referral pathways and MTSS system and where we would fit in with students kind of tier by tier. But Daybreak Health does not provide those assessments. Alrighty. Well, I will give you all a few minutes back. I just wanted to give you kind of a high-level understanding of the services and the partnership. If any questions come to mind later that we didn't get to during this session, please feel free. This is my email address, so you're welcome to reach out to me. And again, if you are interested, maybe you're here looking actively for services, maybe you just want some more information about how they work, or maybe you got all the information you need today, just respond to that poll and we can follow up based on what you're looking for. But I wanted to give you all another thank you for taking the time to learn a little bit more about this. Thank you for doing the research on how to provide more support and more help to your students and families. We really appreciate being able to partner with schools to do so. So thanks again, all of you, and we will be in touch. Take care.